I'm thrilled that Lewis is back because we have such a huge show today. There's the story I want to talk about that has been going completely viral, making headlines over the last 24 or so hours. And it's about a Vulture capitalist increase to the price of an AIDS medication. You might have heard about 32-year-old former hedge fund manager turned pharmaceutical businessman Martin Shkreli, who purchased the rights to a 62-year-old drug used for treating a number of life-threatening parasitic infections. And he raised the price overnight from $13.50 per tablet to $750 per tablet. The drug is Daraprim. It's used for treating toxoplasmosis, which is a parasitic infection that can be life-threatening in babies and for people with poor immune systems, like, for example, AIDS patients, cancer patients, etc. It was selling for slightly over $1 a tablet several years ago. The prices have increased every time the drug was sold from one pharmaceutical company to another. And now, most recently, this 5,500% price increase since Shkreli acquired it. And according to Shkreli, they're going to use the money they're going to make from increasing the price to develop better treatments for toxoplasmosis. He says this isn't greedy. He says this is being done in order to create better treatments. Now, he did an interview on CNBC, and the CNBC anchor didn't even agree that a better treatment was needed. Shkreli disagreed. Let's take a look at what he had to say about this incredible price increase.
Shkreli joins us now from the NASDAQ. He's the CEO of Touring Pharmaceuticals. Martin, thank you for joining us.
Thanks for having me.
Now, you guys have said that the reason you increased this price so much after acquiring the drug was in order to do the research and development to develop a better version of Daraprim. I just got off the phone with an HIV doctor who told me they don't need a better version of this drug. What are you doing here?
Yeah, that's not true. There's a recent paper that suggests that 2 patients died due to autoimmune encephalitis from toxoplasmosis. So there's a lot of people who die of toxoplasmosis every year and this field desperately needs new ways to treat toxoplasmosis. For instance, the current drugs right now target the folate receptor of the bug. There's no other way to kill toxoplasmosis as of right now. So we're working hard on trying to find new ways to do that.
So what a lot of companies do is raise venture capital funding when they see an important market for a drug, rather than raising the price on the current patients who need it to survive and who have no other choice but to take it and pay the higher price. Why wouldn't you go that route?
Well, we did raise one of the largest Series A financings in history for a biotech company. We raised over $90 million. And we also feel that this is the more appropriate price for Daraprim.
This is a huge, huge issue, and Shkreli defended their actions 100%. And there was a good point made, which is why usually when you want to develop a better drug, you don't increase the price of the current drugs we have, which just affects the people who are sick. You raise venture capital. And Shkreli responding, Lewis, saying, yeah, we did that. We raised $90 million bucks. But we're raising more money in order to do this. This is very, very sketchy, but I don't even care about Shkreli specifically. What I care about, Lewis, is that this is exposing the corrupt and immoral nature of how we function in this healthcare world. Healthcare is considered a product to be bought and sold for profit on the capitalist market. This includes healthcare treatment, and obviously it includes drugs, when we should really be talking about healthcare and access to medications as a right, as an issue of public health.
Yeah, well, this is an issue you can tackle on many fronts, right? You have the for-profit healthcare system with health insurance companies.
Right.
You have the patent system, which some people say we need to do away with because it is causing medications to have prices like this. It's a complicated issue.
Hugh Reinhardt, who is a healthcare economist, said, quote, he, being Shkreli, bought the patent and he's milking it for all it's worth. In a way, I thank him because it's really sort of like putting a sign on your back saying, kick me. Sometimes you need some sentinel effect that wakes people up. Look at the difference in prices for the same drugs in the United States and in other countries. And we've talked many times, Lewis, about the exact same drug, not an inferior version, but the same drug being sold for a fraction of the price in countries like India and in European countries and even in Canada compared to the prices in the United States. This is where standard corporate vulture capitalism is an infection that needs to be cured. And that is the status quo of the healthcare industry. We are, I am a capitalist, right, Lewis? I believe in enterprise and in creating businesses, but I believe in regulated and controlled capitalism that takes into consideration the broader good. And here we have gotten lost thinking about the broader good when it comes to healthcare and medication, and we're just so far from it.
It's all about profit. Luckily for many Americans, we are able to receive those drugs that come in from India and Canada. Can you imagine the situation we'd be in if that did not happen?
Yeah, able to, in spite of what the law is, right? I mean, you can go online and order some of these medications from other countries, but it's not really legal.
Well, no. In many cases, you can get drug prescriptions for these, alternative drugs. I suppose in some cases it could just be the patent has expired, or there are situations like that. But we are able to get some of those drugs here.
There's a new masterpiece series on PBS called Indian Summers, and it's a pretty cool twist on the period drama. It provides a cool look into British and Indian experiences during the time. And I don't mean Indian as a Native American. I actually am talking about India. It's a 9-part series. It premieres Sunday, September 27th at 9 Eastern, 8 Central on Masterpiece on PBS. And it's set in India in the early 30s, the 1930s, during the sort of twilight of British rule in India, which ended in 1947. And I am really looking forward to this. I started looking into this time period in India. I admit I did not know that much about it, and it's just fascinating. And the cast includes Indian, British, and Pakistani actors. It includes Julie Walters, Nikesh Patel, and Henry Lloyd Hughes. And it's set specifically in the Simla region near the Himalayas, where the British would sometimes relocate during the summer to work and to socialize. And it is absolutely a fascinating area, a location, and a time period. So check it out on PBS. It's Indian Summers on Masterpiece, starting this Sunday, 9 Eastern, 8 Central.